Good afternoon. I'm calling to order this meeting of the Housing Policy and Development Committee. This is our regularly scheduled meeting. I'm chair of the committee, Councilmember Cam Gordon. I'm joined today by Council members Ellison, Reich, Goodman, and Bender. We're a quorum of the committee, so we can conduct our business. Today we have two public hearings. We have 4 consent items on the agenda and 2 discussion items, but we also have 2 addendum items, which are just something that was referred from another committee to us, so I'd like to put them on the consent agenda. It's just to refer to subject introductions to staff. So I'll go through the consent agenda, and then we can open up the first public hearing after a little presentation. On the consent agenda, the first consent item is extending exclusive development rights for the Snelling Yards development project at 3601 East 42nd Street. The second consent item, fourth on our agenda, is authorizing an agreement with Towerside Innovation District to implement part of the 2013 Metropolitan Council Livability's Community Demonstration Account grant. And the next consent item is approving the Minneapolis Homes Development Assistance Round 4 guidelines, and also approving a very interesting passive housing funding pilot project. The 6th item on the agenda, the next consent item, is authorizing a request for proposals for our Housing Opportunities for Person with AIDS grants. And then I'd also like to move item 9 and 10, which is just referring to staff, the subject introduction of our Sustainable Building Ordinance, and referring to staff, the Affordable Housing Right of First Refusal Ordinance. Would any committee member like to pull any of those items for discussion? Seeing none, then I will move that consent agenda. All those in favor, please say aye. Aye. Any opposed, please say no. The consent agenda passes. Now we'll move to our first item on the agenda, which is the public hearing. But first we'll have a brief presentation from staff on this is on the 2019 Consolidated Plan Action Plan. Welcome.
Mr. Chair and members of the committee, I'm Matt Bauer with the Intergovernmental Relations Department, and we have before us today the 2019 Consolidated Plan Action Plan, which is the city's application to HUD for our entitlement funds. The entitlement funds are the Community Development Block Grant, Home Investment Partnerships, Housing Opportunities for Persons with AIDS, and the Emergency Solutions Grant. We will be requesting a public hearing today, and then asking you to direct staff to summarize any comments received during the past 30 days and this hearing to be included in the plan submitted to HUD. We'll ask for the approval of the action plan and authorizing staff to submit the plan to HUD. We're looking at submitting it on June 10th. And then due to the late notice from HUD of what our entitlement amounts are for this 2019 program year, you acted on an estimated budget in December. The actual allocations are different from what you adopted as a council in December. So there's some 2 staff directions. One is to direct staff of the finance department to apply proportional allocation adjustments to the programming and project allocations that were described in Schedule 4 of the 2019 city's budget. And then also directing staff to incur any necessary pre-award costs for programming consistent with the action plan. Our program year starts on June 1st. We won't be able to submit the application to HUD till June 10th, and then they have 45 days to approve it. So in the meantime, we will have programming that will need to be started, and so this allows us to incur these pre-award costs before we get the agreement, so we can keep these programs running at their current levels. And there will be it won't affect the budgets that are included in the plan for those programs and projects. Generally, the 2019 plan is the last year of the 2015 5-year strategy. We will be embarking on a new 5-year strategic plan with the 2020 plan that you will be coming before you next spring. The only change, there are a couple of key changes made to the existing five-year strategy that are included in this action plan. One is the city, as I believe last cycle, changed the definition of what's a poverty concentrated and minority concentrated areas of the city for purposes of the Affordable Housing Trust Fund. So that's reflected in the plan. We also amended the plan to reflect council direction last fall to add essential services as a eligible use of our emergency solutions grant funding. And currently there's an RFP out for capital funding and essential services and emergency shelters. I believe that is wraps up at the end of this month, so you should be seeing something this summer along that line. And then finally, we use this as an opportunity to update our emergency solutions grants policy and procedures, which is found in the appendix of the action plan, to be closer coordinated with the continuum of care of the county and HUD mandates. So we updated some language there and adjusted some program design there. Staff intends to submit the plan on June 10th. And with that, that's my presentation on this, and I think the next step would be for a public hearing on this. I can stand for questions now or after the hearing. Thanks.
I don't see any questions right now. So thank you very much for the presentation. Maybe there'll be some questions after it. I'm prepared to open the public hearing, so I'll do so. The public hearing is now open. I know there's one person who's signed up to speak, and that is Sue Phillips. So welcome. I'll also note that, and I appreciate the written comments that you provided up here for us as well.
Mr. Chair and council members, I'm Sue Watlow Phillips. I'm the Executive Director of MICA, Metropolitan Interfaith Council on Affordable Housing, and Vice President of the National Coalition for the Homeless. And thank you for the opportunity to comment on the 2019 Consolidated Plan. MICA is a organization that's been around for 30 years, and so we've been commenting on these plans for a long time. We believe that everyone, without exception, should have a safe, decent, accessible, and affordable home, that we need to be welcoming communities, and that we need to love and treat other people the way that we want to be treated. So very quickly, I'll summarize the comments, Mr. Chair, if I may. Is that MICA, as I think all of you know, brought a fair housing complaint against the city of Minneapolis in 2015. We settled that in 2016 with a voluntary compliance agreement, 5 years, and then we worked with you in amending the analysis of impediments to fair housing. And so some of our concerns are ongoing concerns that we have with the plan, where we don't see specifics identifying how we're addressing those impediments. We also are very concerned about the community engagement, which was one of our concerns for bringing the complaint, is making sure that people throughout our community are actually having input into the decisions about the plans are being developed. And while I think that there's been an increase in that, I do think that we need to continue to expand how we're having community input on these plans and helping people understand that this is our federal dollars coming to the city and how we can utilize them. We encourage you to really look at using some of the administrative dollars that are supposed to be going towards our authentic community engagement, to really expanding that and doing actual granting out of some dollars to some of the folks that helped with the analysis of impediments to fair housing, and amending that so that we could do actually community engagement in small settings and in communities across our metro area, as well as having quarterly roundtable meetings, especially as we're going into the 5-year plan again, so that our community really understands that. We want to applaud you for expanding the use of the Emergency Solutions Grant. We have been pushing that it would be also used for essential services for a long time, and that in addition to capital, because it's critical that's be used for both, and that can be used for prevention and rapid rehousing. We continue to have concerns about what HUD is putting on as restrictions to the city and to other communities in regards to the use of both the ESG dollars and other continuum of care dollars, and so we are very happy that you're coordinating with the continuum of care. But what we're seeing is that HUD is continuing to tell communities what to do, as opposed to having the responses come from the community itself. And so our concern is that we have concerns about the use of data privacy being broken by our HMIS, the Homeless Management Information System, and the coordinated entry is not a very rapid way for people to get into the different housing programs that are available. And so we have people here in Minneapolis that have been on the wait list for a year. And so this is an issue for people actually getting services. We need to continue to do our coordination between our public and private housing. Some of you may or may not know that with our long-term homeless or chronic homeless programs at the state level, is that we have people that have been living in supportive housing funded with homeless dollars for now 10 to 15 years while living in permanent housing. Both the housing is subsidized by homeless dollars from HUD, as well as state housing dollars that are homeless dollars subsidizing people that are in permanent housing, as well as homeless service dollars. So we encourage you as a city to have your lobbyists work with us as we're trying to get those folks transitioned into mainstream programs so that we free up our homeless dollars to be used for the folks that are experiencing homelessness today. And this is really putting a backlog into the system right now. If you have not looked at the U.S. General Accounting Office's homeless reports from 1999, 2000, old reports, but really good about how we can use mainstream resources to do that. We've encouraged the city throughout the time that you've had home funds available is to use a portion of that for tenant-based rent subsidies. That's used in Anoka County. If we use just $20,000 for rent subsidies, we could serve 5 to 8 families with rent subsidies. That's what it costs us to have 5 or 8 families actually in a shelter here in Minneapolis. So utilizing our dollars a little bit more wisely. CDBG funds, community development block grants, we're concerned that there's not a real high priority given to folks at 50% and below and 30% below in the plan. It's a very vague statement, is that 20% of the units will go towards people at 50% of median below. With our critical need for our very lowest income people having housing, we really think that focusing these very limited resources that we know have been cut to the folks in greatest need. And then, as I was talking earlier with Matthew about just the initiatives, they're not identified in this plan, and I know that they're part of other plans. Just encourage us to continue some of the work that was done in the previous administration, as well as the work that's being done in this administration, utilizing the 4D to help as a classification to get more landlords involved in that, to keep housing affordable for our renters, as well as, I think most of you probably are aware that the low-income housing tax credit, when we made the major tax law changes last year, we can now do what's called income averaging. And so we talked about this last year with the MSP board. Unfortunately, I was not able to attend it for the QAP qualified allocation plan for 2020. But basically what this does is that we can create, with the low-income housing tax credit, units that are like at 80% and then units that are 30%. And then we average that to get to the below 60%. And so this really allows us to do more targeting. It's still an eligible use under the 4D tax program, so encourage
And we
you.
did modify our guidelines so that we are able to do that now.
Great, thank you, sir. And then we just want to, again, just recognize that people are homeless because they don't have enough money to get into housing, okay? Also, we need more housing, but people with money that have a lot of issues can get into housing. People without money have a hard time getting into housing, and people without money or very little money that have issues like criminal issues, mental health issues, landlord, tenancy issues, other things, almost impossible to get into housing. So myself, I have a felony. I also have chemical health issues, and I own a home. So it's about having resources. So we need to match up our livable incomes and our housing together. So for a person in Minneapolis to afford a 2-bedroom or a family, they need to be making almost $21 an hour working full-time, $18 an hour for a 1-bedroom. So it's changed a lot over our lifetime. My first place was in southeast Minneapolis for $125 in the early 70s. Used to rent houses for $200 a month. It's not the world today. And so we need to really make the changes to address the changes that are happening within our society. And because most of us were renters at some point, we need to recognize that we are all those people, and that we need to continue to make sure that we are providing opportunities and choices for people in every community, and in every neighborhood, and that we need to have equity in place in every neighborhood so people can live as they want to live in the different settings that they want to live in. We applaud the city for your work on lead, and Councilmember Ellison has worked very closely with our staff on that, with Tycia Fletcher and with Lashella Sims, as well as your staff have worked with us at the state capitol in trying to increase dollars for making our homes lead safe. For every child that becomes disabled by lead, it costs us $100,000 per year for the rest of their life. So we're talking about every child that becomes disabled, their brain becomes so damaged that they go on disability. We're talking about $6 to $8 million per child for the rest of their life. Doesn't take long to add up that when you have 700 kids poisoned, at least in Minnesota, what those dollars are if even a portion of that population becomes disabled for life. So Tycia's son, as you well know, is disabled. The bill is named after him, the Dustin Luke Shields bill. Unfortunately, it was on the short list and got cut in the very last minutes again this session. So we hope that you will work with us in increasing that. We appreciate you have $61,000 plus in your lead hazard reduction program. And then just continuing to do the coordination with other plans that you have here. And I know that you're working on that more and more, and we see that beginning to show more in your consolidated plan. And then the other concern that we have is, and we've talked about this before, is as you acquire and demolish blighted housing, which we think that there needs to be a program to do that, and you have 1.5 million that's doing that. We want to make sure that there really is in place housing for people that may be displaced, that there is no way that they become homeless, and that then when those properties come back online as far as vacant property, we use it for urban homestead, or we use it for creating some more affordable housing, tiny homes. Micah is one of the collaborators in the Envision project, the tiny home project, so we encourage you to join us at our annual meeting. You have this little sheet also, which is coming up on June 11th, where we'll be talking about that, and we greatly appreciate the city looking at changing its zoning so that we can do tiny homes within the community. Then we continue to be concerned how we're using 20% of the CDBG dollars for administration. I know it's used for a variety of different things, but you would not allow any of us that have received grants from you to use 20% probably for administrating our program, so we want the city to be as positive of a good steward of our dollars too. So as we continue to move ahead, as I mentioned to Matthew, we would love to work with you in the community in having roundtables with community residents and with our diverse communities, and strongly encourage you to take us up on that offer. Thank you, sir.
Well, thank you very much. Appreciate the comments and the offer, and I'm sure there'll be things we'll take into consideration, especially as we're entering into the phase of a new 5-year plan. Is there anybody else here who would like to speak on this matter? Come up and introduce yourself, please. Welcome.
Yes, Mr. Chair, members, thank you. I'm Reverend Dr. Jean Lee with Children's Hope International, which is a legal advocacy and legislative organization, also R&R Family Centers, which are shelters, transitional permanent housing, and APAC, which is a housing consortium. I just wanted to make a few comments, and I don't want to be redundant on the other issues brought before you, but I do appreciate getting notices, but the notices I get are, you're having a meeting, here's the agenda, and so forth. And I think what's helpful would be to have more input from the community as far as you're making your decisions and coming up with the plans, how other organizations and people could be involved. And I know that to some extent it was addressed in a handout by Micah as far as input from the stakeholders. The second issue, and I only raised 3, is that I had a look at this Navigation Center report by Margaret King and noticed who some of the different contractors you have doing some of the different services for the city are. And I know these different organizations, and I know others who maybe not be contracted if it's on a competitive basis with the city. But I also know one that had recently been contracted who I I would have raised concerns because there's discrimination involved as far as why they were given a free rein as far as the ability to provide services when it's not. It's supposed to be for the whole city rather than just for specific groups that they might cater to. But that's a private conversation. And the last issue I wanted to raise was that as you come up with your plans that run for periods of 5 years, 10 years, and so forth, I had a chance to talk with an IT person from Best Buy, and they tell me that they're on a similar track that we are as far as how we adapt housing to address the needs as far as being able to provide holistic health care. And this is an area where technology is going to come up fast, and Best Buy has already gotten involved in it, as well as Amazon, Google, Microsoft, and those people. So what they'll be coming out with, just to give you a heads up, is something that as you plan for how you modify homes or get homes rehabilitated and so forth and changed, that they consider how they're adaptive to these new technologies, and also because of the high cost of healthcare and the aging population and the need to retain people in their homes as far as the most cost-effective method. Thank you.
Interesting, thank you. Is there anyone else here to speak on the consolidated plan? Seeing no one here, then I'll close the public hearing. Are there any questions or comments from committee members? I'll just make one note that during the discussion of this, essentially what happened is the federal budget increased the amount we got by, I think, around $800,000. And we're approving now proportionally distributing that throughout at least 4 of the programs that would make a difference in. We did hear from the mayor's office some interest in seeing adjusting the money and focusing it on more successful and effective programs, and others. We felt like, I felt like, and I think the staff also supported going forward with this recommendation right now, with an understanding we can always go back and make adjustments in the future if we want to bring it back to the committee. So I just want to warn you that the mayor's office is doing a little research to kind of make sure that this allocation will have the biggest impact. So we could hear from them again. But with that note, I will move the staff recommendation, and that's all 5 items on the agenda. Any questions or comments on the motion? Seeing none, then all those in favor, please say aye. Aye. Any opposed, please say no. That motion carries. And now we can move to our second item, which also involves a brief presentation and a public hearing. This is on the Housing Replacement District 4 Tax Increment Financing Plan. Welcome.
Chair Gordon, members of the committee. Housing replacement districts are a special type of tax increment financing district for scattered site single-family housing, authorized by special legislation enacted in 1995. The purpose of the district is to acquire and prepare parcels for the development of housing not to exceed 150% of average market value of single-family homes in Minneapolis. This would be the 4th district. Previous council-approved districts in 1996, 2003, and 2009. Districts are open for adding and removing parcels for 5 years, and thus we need a new district. We may designate 500 parcels to be included in all of the housing replacement districts. Currently, there are 357 parcels that are designated, and so we have capacity for about 140, well, for exactly 143 parcels. In our current action, we're proposing to add 54 parcels that we know are going to be developed for a housing purpose. The intention of staff is to add additional parcels later as we prepare more parcels for development. And we're requesting delegation to the CPED director to add those parcels as they're identified and approved. The properties that are added into a tax increment district earn increment for 16 years once they're placed in the district. Our estimate for total costs is $10.5 million to assemble the sites. TIF contributes 75% or $7.9 million, and the city contributes 25% or $2.6 million. Sources for the city funding are something that are part of our regular programming and designated in the city budget. The current plan was transmitted and open for public comment on April 5th, 2019, and we did not receive any comments. The map that's represented here shows in orange are the housing replacement district parcels that are currently active in housing replacements 1 through 3. And then the blue dots are the 54 parcels that we're adding as part of this current plan. I can take any questions at this time.
I don't see any questions.
Okay.
Thank you very much, and thank you for the excellent staff report and a clearly written plan. I'll open the public hearing then to see if there's anybody here to speak on this. Nobody has signed up. Seeing nobody stepping forward then,
Mr. Chair, Sue Watlow Phillips from MICA. Could I just ask a question on how this will impact the Upper Harbor Terminal and that whole process as that's moving forward with where this is located? Looks like it's very similar to that area.
so we can take that question, and then after the public hearing is closed, we can respond to it. Seeing nobody else stepping forward to speak then, I'll close the public hearing. I believe it will have no impact, but would you, perhaps staff can add?
We do not believe there would be any impact on the Upper Harbor Terminal because this district is for the creation of single-family housing.
Thank you very much. So are there any other questions or comments on this? Seeing none, then I'll move approval of the resolution that would create this housing replacement tax increment financing plan. All those in favor, please say aye. Aye. Any opposed, say no. That motion carries. And now we'll move on to item number 7, which is this is the Missing Middle Housing Pilot Program. And welcome back.
Yes. All right, here we go.
You're the star for today.
Apparently so, yes. Okay. Chair Gordon, members of the committee, we're here today proposing a Missing Middle pilot housing program. Missing Middle is a housing type that's not typically prevalent in Minneapolis. Through this program, we're defining it as 3 to 20 unit housing developments. In our long-range planning division, it's defined as 2 to 20 units. The only reason that we're defining it as 3 to 20 units is because we have other programs that create duplexes. 3 to 20 unit housing developments that typically require less square footage and result in smaller building footprints. This type of housing is less than 20% of the homes that are currently present in the city of Minneapolis. We're creating this pilot in response to several housing trends. There's been a loss of affordable housing units generally in the city due to market forces. Almost half of households and over half of people of color and indigenous households are housing cost burden. And single-family homes currently occupy about 70% of city lots, but only provide 45% of units. So the intention of this program is to look at ways that we can use our land more efficiently and produce more units of housing on lots. The program is also in response to the current homeownership and rental markets. Homes are selling for a median $260,000 sale price, and the price increases have been almost 12% a year. Rentals are similarly averaging at a very high cost, $1,246 for a 1-bedroom and $2,426 for a 3-bedroom. We also have low vacancy rates in our city, and so the intention of this program is to look at production of additional housing units. The program comes with affordability requirements. Our funding is connected to the affordable units that are created in any development. In the case of rental projects, we're recommending 20% of units affordable to 50% AMI households, with a preference for projects that provide deeper affordability or longer affordability terms. And on the ownership side, we're recommending 10% of units that are affordable to 80% AMI households, with a similar preference for projects that provide more affordable units or deeper affordability. In North Minneapolis, we're recommending that affordability assistance that's provided to homebuyers is recaptured and then recycled in Minneapolis Homes programs. In all other parts of the city, we're recommending that the units that are created are long-term affordable units that have a 30-year affordability requirement. The program is in response to the 2040 Comprehensive Plan as well, in alignment with the Minneapolis 2040 Comprehensive Plan. It increases the supply of housing and its diversity of location and types. So cost of entry to homeownership can be high because of few housing options. By creating townhomes or triplexes or condos, we're hoping that we're going to just diversify the types of housing that are present in the city. More residents in our city also increase the tax base, make it so that there are more people that can visit our local businesses and spend money within the city. The 2040 plan also spoke about producing housing units that meet the changing needs of Minneapolis residents in terms of unit sizes, housing types, levels of affordability, and locations. Missing middle housing is typically more affordable than single-family detached housing is. Encouraging density is something that we're hoping is going to have an impact on vacancy rates. The funding that we provide is going to be based on demonstrated need and only available for the affordable units that are in any particular development. We're recommending up to $70,000 per affordable unit, and projects with a compelling basis, such as a longer affordability term or lower AMI restrictions, we're recommending for up to $95,000. The type of funding that we're providing is gap funding. In the case of a rental project, funds cover the gap between the total development cost of a home and a total development cost of a project, and the debt and equity that affordable rents can support. In the case of ownership projects, the funds cover the gap between the total development cost and a combination of the fair market sales price and what a home buyer can afford to pay for their first mortgage. Eligible properties in the pilot, we're recommending that effectively any parcel in the city could be an eligible parcel. We will be advertising city-owned property as a component of the request for proposals if council approves the pilot program and authorizes the release. However, we're also envisioning that privately owned parcels are something that could be included or applied for development of projects.
Can I just ask, does the lot have to have no building on it? You mentioned vacant lots, but what if there's already a building there?
Yep. The way that we've framed the guidelines, we've said that there can be no net loss of units. So if there's a building on a site and the intention is to demolish that building and then build new units, then there would be a need to ensure that more units are built than what was in the existing building.
And would a project that's going to add units to an existing building be eligible?
No. Thank you, Andrea. Yeah.
Is there a condition under which, I'm a little bit confused by that too, so that's why I asked.
If there's a recommendation from council that we come back with some clarity about that, then we could take that step. But our thinking about the program is that it's new construction on vacant lots, and that any existing buildings would be what we were sort of discussing or trying to think about was if there's a scenario where there's 2 vacant lots on either side and there's a building in the middle that's a vacant building, would we say no to demolishing that building in order to achieve something that's more dense? That was the thinking.
And I can appreciate that. Obviously, preservation is really important, I think, to the council, and that's really clear that it is, but this isn't supposed to be for preservation, this is for adding units, so.
Exactly.
That's an interesting question, and maybe we have some more feedback. Councilmember Goodman.
Well, I hate to jump ahead because I don't know what else is in the presentation. My question is about the length of affordability for the subsidy, as well as how we will be monitoring to ensure that the people living in the unit are actually in need of the unit.
Yep.
Is that later in your presentation?
It's not, I actually only have 1 slide left, so I could jump into it or I could just
We can just let her
respond.
do the last slide and then I can
Okay.
get deeper in here.
Sounds
So
good.
the last slide. On May 1st, we conducted an information session with approximately 50 people. Our intention today is to review the pilot guidelines and also hopefully achieve issuance of the request for proposals. And later in June or July, we're planning to release the request for proposals, which would facilitate construction beginning in spring of 2020. And now I'm done and ready to take questions.
Do you recall the questions that had to do with the length of affordability and how we're going to make sure that the renter or the home buyer is somebody who needed it,
Yep.
qualified?
So in the case of our rental projects, we modeled this program after the Affordable Housing Trust Fund. And so similar to the Affordable Housing Trust Fund, we're envisioning a 30-year affordability period that's secured with a note and mortgage, and we're also envisioning that we would be contracting with Affordable Housing Connections to do the monitoring for those units. In the case of the ownership units, as I mentioned, properties in North, our recommendation is that we use a recapture method of home sale, which means that the affordability would be connected to the first purchaser, and after the first purchaser sells, then we would recapture funds that are that were invested by the city in affordability assistance and recycle them. In the remainder of the city, we're recommending a long-term affordability reservation for all of the affordable units. And we have a process where we've been approving long-term affordable housing providers. Currently, there are 2 approved providers, City of Lakes Community Land Trust and Twin Cities Habitat for Humanity. And the only reason that we didn't apply the reservation in North is because of feedback that we've heard from community members in North. In North Minneapolis is where a majority of vacant land is currently located in the city. And so we've heard a concern about reserving all of that land for long-term affordable purposes.
Okay, and then can I ask one more question?
Absolutely.
Kind of along the lines of the last question with regard to vacant lots versus existing housing. So, I mean, people who live in North Minneapolis who already have income issues are not going to be able to purchase multiple lots, combine them and build something dense and then live in it themselves and rent it out. Okay, so it's mainly going to be investors who probably own 1 or 2 buildings and they might have bought a side yard from us. And aren't you concerned that like what is affordable currently will be torn down? And then you could have, let's just say 2 triplexes, 6 families, they'll be displaced. They'll get $95,000 per unit to displace them.
Mm-hmm.
And then they'll come back in and yes, they might rent them to somebody else where it's affordable, but it's displacing 6 families that we have to figure out then what's going to happen to them. So I don't consider it 1-for-1 replacement because I'm thinking about the actual person who loses their housing because there's a $600,000 incentive to build a 6-plex.
Mm-hmm.
So how are we going to prevent that kind of thing?
So I'm hearing a recommendation that we are more explicit about displacement being expressly something that's not eligible under this program.
Yeah, I think that maybe we need to be even more specific and say, we're going to roll this out for vacant lots. So that we know for sure the only ones we're displacing are the animals living on that lots, like the worms and the birds and that kind of thing. Because I'm concerned, I mean, I hope I'm proven wrong, but with 2040, I'm concerned that already bad landlords congregating on the north side are looking for their own out as it is. And so then they disinvest in their buildings, and then they accumulate multiple lots, and then they get money from the city and they displace people. Starting with just the vacant lots, if there's just so much interest, we won't have enough money if there is anyway. If there's a limited amount of money, maybe we should just start with vacant lots, because then we won't have to address the issue of displacement versus addressing the issue of displacement and then trying to justify it.
That's a fair recommendation. Yep.
So let's discuss that further and see where it goes. I could see that also creating a problem around the university area, where I could see people holding lots of properties. I'm not sure what to do about an empty, abandoned building that's been abandoned for years, as opposed to actually a vacant piece of land or those kinds of things. But displacement, I think, is a concern we may share, or I share concern about displacement. Council President Bender.
Thank you, Mr. Chair. I think I would encourage us to have more nuance and use more data before making a blanket decision like that. For example, in Ward 10, where 80% of my constituents are renters, I look out 5 years and wonder how many people are going to be able to live in my ward at all in that time frame. And so it's also a place of our city, like many, where we are currently losing naturally occurring affordable housing for profit development that has no affordability in it, as we wait for our inclusionary zoning ordinance to be ready for a vote. And so in a ward like mine, a place where you might see you might lose a duplex, for example, but you might gain a 10-unit building that has affordability in it, that might be a trade-off that makes sense in a place where you can get higher densities based on the context of the neighborhood and our plans, as well as the context of affordability in the neighborhood. So I hope we might be able to look at that kind of data. We did map our city's entire private market back, I think it was 4 or 5 years ago. Councilmember Reich and I did a staff direction and asked CPED to map our housing market. So we have some data which is now outdated, but I hope we could start to use some of that data to help us guide these decisions, so that we might have more nuance into the context of where missing middle housing that has a 30-year affordability component to it could make a huge difference for folks in neighborhoods that are at very, very high risk of displacement now.
Just so we get a picture of it, could you estimate how many units this actually might create? It's only $500,000, right? And we're talking 70 to 95,000 maximum per unit. So maybe we don't need the gap, or maybe you think we'll definitely need the full gap for everyone. So it's not going to be that many units. So what's the estimate that you have?
500,000 was approved in the 2019 budget for the missing middle housing pilot. We're recommending that we release the RFP for the missing middle housing pilot at the same time as the Minneapolis Homes program, and the budget for the Minneapolis Homes program is $4,050,000. So depending on response, when we receive the proposals, then we may come back to council with a word recommendation that mixes the use of both of those funds.
Okay, on that, I think, and I might have a question too, but Councilmember Bender has a question.
Thank you, Mr. Chair. I just want to clarify what I think we're discussing as a proposal, which is to only focus these funds on vacant lots, which are primarily located in North Minneapolis, which do not have a 30-year affordability component.
Correct.
So the current proposal is to focus money that's intended to increase affordability only in a place where affordability is not required. So that is my concern. I don't support that.
I stated that the majority of vacant lots in the city are located in North. I do not believe that this program is focused exclusively on North.
If we limited only to vacant lots, my concern would be that those sites do not have the affordability component that this program was intended to encourage. Then we shouldn't call it an affordable housing program.
So I think that's a valid point to make. I think you somehow avoided actually answering the question that I posed. I was wondering so let's just say it's just the 500,000.
I'm ready.
Let's say it's just the 500,000 right now.
Yes.
How many units would you predict that in the missing middle pilot program that could help create? Is there a maximum or a minimum you're thinking?
Our estimate through the 2019 budget process was 20.
20, so that's 20 units. So that's just a modest number of units. I'm just going to say this comment on it. That would give us a chance to see actually where they were and what happened. Even if we had guidelines that weren't quite right, we could then assess that.
Correct.
Now that potentially you're thinking of combining this then with another program that could lead to a creation of another 20, or how much, is that right?
Yes, we're recommending releasing this at the same time as the Minneapolis Homes Development Assistance request for proposals.
So you said that in the guidelines I read that the missing middle pilot cannot layer funds through other programs, including the Minneapolis Homes Development Assistance Program.
Correct.
Okay, so, but now you're saying that you might come back and say, let's layer the funds for these two programs?
Hi, Mr. Chair, members of the committee. What we're trying to convey is that it's possible that will be proposals that we receive through Minneapolis Homes RFP that are also sort of fit the criteria of the missing middle pilot.
Oh.
And that, there could be, the Minneapolis Homes right now allows for funding up to 1 to 4 units, I believe. And so it's possible that there will be some of that missing middle proposals that would be eligible for both. And so while we're proposing this as a pilot, and the pilot is very limited, there's $500,000 in the budget specifically for the pilot. And also speaking to Council President Bender's comments on vacant land, we are, unlike Minneapolis Homes, we are not proposing that we limit this to only city-owned land, because the majority of city-owned land is located in North Minneapolis, but there's a lot of vacant land throughout the city, and all of that would be eligible to apply for the missing middle pilot. Additionally, just to make sure it's crystal clear, all of the city subsidy would only go to fund affordable units. The only difference is that on the ownership side, the long-term affordability is not a component of ownership, necessarily a component of ownership development that could occur in North Minneapolis, that would be required. That said, we are aware of a proposal that will likely come in for this pilot that is for long-term affordability in North Minneapolis using this missing middle concept. So we expect that we would get proposals on vacant land for long-term affordability also in North Minneapolis, even though that's not necessarily what we're proposing as a requirement of the program.
So would it be required for rental in North Minneapolis?
There's a 30-year there's a 30-year requirement for rental throughout the city.
So citywide. Okay, so
Yes.
just to clarify that, for that affordability would be in place citywide, but for the home ownership, that requirement would not be put in place in North Minneapolis as this is proposed. And I think
Correct.
it's going to be easier than if we talk about for home ownership. Sorry, what did I say? I left that off. Okay, correct, for home ownership. So anything that resulted in kind of helping the small-scale missing middle from the Minneapolis Homes Development Assistance is a separate program. That's a separate thing. We're just saying we might help it through this program too. But that's not about this missing middle program. Okay, I'm a little bit curious if committee members think we're ready to approve this today, or if there seems to be some lingering questions and angst about it, that it might need some a little bit more work, maybe at the committee level. Councilmember Ellison.
I'd be interested to hear feedback from my colleagues, but I think given the clarification, understanding that there's still going to be affordability, long-term affordability, even in North Minneapolis, I'd be comfortable to move ahead, but I'll sort of interested in what my colleagues have to say. But that clarification was really useful for me, and for, I have an interest in making sure that there's long-term affordability in North Minneapolis. So
I appreciate you weighing in, trying to have a consensus process here, even though I know we take votes on things. Councilmember Goodman.
But the questions have been answered. This is $500,000. Let's move on. I think we should pass it today. We don't need to discuss it with everybody else at committee of the whole. That will only raise 20 more questions. So I would urge us to do our work and get it done. Thank you for asking.
Appreciate that. I don't see anybody else weighing in, but I think the fact that it's a pilot and it's a limited number of units, it gives us a chance to, even if we make a few mistakes or not, or we come back in and see who actually was requesting it and we can tailor it down better. I think that makes a lot of sense. So, seeing how this has gone so far, I'm prepared to move that forward. So I will. And all those in favor, please say aye.
Aye.
Any opposed, say no. That motion carries. Thank you very much. Now we have an update. Last item on the agenda is just kind of a update. Potentially, I suppose we could have another report in after it's fully closed. But I thought this would be nice to get an update on the Navigation Center, given the fact that it's scheduled to be closed on June 3rd. I know that we had a study session on it, but perhaps the city coordinator can tee us up for a little discussion here.
Thank you, Chair Gordon, members of the committee. My name is Neria Rivera-Vandermeid. I'm the city coordinator, and I'm appreciative of Margaret King, who has joined us today, who's really been on the ground and will be able to provide a more in-depth and in real-time update. We appreciate the study session that we had at Council Bender's request, Council President's request last month, and happy now to provide an update as we near the closure of the Navigation Center. So with that, I will defer to Margaret.
Thank you very much. Welcome.
Thank you. Good to be here. So my name is Margaret King. I'm the consultant working with the city and the county and the state on the Navigation Center. And I've got just a real brief kind of status report. I saw Steve Horsfield come in, and I want to make sure everybody's aware that he's here and lift him up as the executive director of Simpson Housing, who really were the primary operational partner at the Nav Center, still are. So thanks. I'm glad he's here. So this first slide here is just a quick look at organizational chart that essentially basically reflects how the work happens at the Nav Center. As everyone knows, you all know, it's a very unconventional project, I would say. It got stood up very, very quickly and really is a massive kind of barn raising by the community. So it's not a traditional org chart at all. But it gives a sense of who the primary partners are. So Simpson is providing operational support, and they're really doing the heavy lifting of running the Nav Center. In addition to that, the other primary partners are Red Lake Nation, of course. They've got a consultant who is coordinating services there. There is what are called native navigators, or essentially case managers that are funded through a private donor. The same private donor who's underwriting the operations. And they are doing case management on the ground with residents of the Nav Center, really intensive one-on-one work with folks to help them get stabilized and find housing for themselves. Simpson is also providing a couple, 2-3 case managers, and also some senior leadership support for service coordination on the ground, which has been really critical. And then the other primary partner has been CPED, helping coordinate on the ground the operations that relate to facilities and property management. Project for Pride in Living is the lead organization there. And so that is a kind of a basic, very quick sketch. Just real quickly, some very very simple take at some opportunities and challenges that we have encountered at the Navigation Center. Opportunities, of course, happen when there's a co-location of shelter and services. And at the Navigation Center, as you know, it's open 24 hours a day. There's intensive services on site for the guests that are staying there. And that makes a big difference. It makes a big difference for making services available to people where they are, and really creating pathways for people so it's easier for them to take advantage of services. And there's obviously efficiencies that inhere when you have a co-location of a bunch of different services and partners. Some challenges, I would say. One is the org chart that we just looked at. Anytime there's a complicated, large, multi-partner program that doesn't have a single lead agency, it's real challenging because this makes communication very challenging, decision-making can be challenging. In this project, I've said this before, but I really have been astounded in a positive way, in a good way, at how well all these partnerships have worked. It's really gone very, very well. But it is a structure that should get some more thought for future projects. Another challenge, I think, is just around right sizing. The project started with 175 people. That is very, very massive for this kind of an intervention. And so that's something to think about. And just because of the size and because of the very vulnerable population being served there, there's some practical challenges around safety and harm reduction. So as far as updates go, here's just a quick picture of how the numbers have scaled over time. So it started at 175. We'll get to a little bit more detail on this in a couple slides, but you can see that the numbers have gone steadily down. It's been about, right now, 50 of the 130 people who have exited the Navigation Center, 52% have exited to positive destinations. The vast majority of those have gone to permanent housing, and other numbers have gone to things like inpatient treatment or nursing homes in a few cases. A few people have gone into involuntary mental health treatment, which is actually a positive destination for those folks. They really need care. So the numbers are good. And I would say that 52% is very high. That's a very, very high number for an outcome for positive exits at a program like this. You can't really see this on the slide, but on the handouts you can see that these are different color codes. So the point of this slide is that stabilization has really happened over time. So emergency response calls have been reduced, have gone down over time. Not in perfect lockstep with the census either. So the census has gone down, but emergency response has gone down faster and more quickly. And that's because of the stabilizing effect of safe indoor shelter. The number of overdose calls have reduced. Everything, all the emergencies have reduced over time as well. So here's some detail. So we started with 176 people. As you all remember, the program was intended initially for 120, but Simpson opened the doors wide so that everybody at the encampment could come. And so that meant that at the beginning there were 176 people there. So far, 130 people have exited. And you've got some detail here about where they've gone. So 58 people have gone into permanent housing. I'm going to talk a little bit more about how that happened in a couple slides. A couple of folks have gone to treatment, nursing homes. The 5 that have gone to inpatient treatment, that's inpatient chemical dependency treatment. And then what we're calling negative exits are as follows. 62 folks have not had a positive exit from the NAV Center. A handful of them, I think around 20, were folks that were asked to leave because they were causing problems for the community there. So they were asked to leave, and in most of those cases, they returned to unsheltered homelessness someplace, is the presumption. We don't really have that data, but that's the assumption. 2 people died of overdoses. 7 people left the Navigation Center in order to go and stay at a different shelter in the system. 10 people just left, and we don't know where they went. 8 people left for jail. 1 person left because they were beyond the scope medically, so they needed nursing home level care, and they left for some destination of that sort. And I think in that case, they were not returned from the hospital because they were beyond the scope. And then 14 people were exited or will be exited in May because they're not participating in services. And I'm going to talk a little bit more about that also. So the current census is 46 people. So of that 46, there's expected to be about 20 left at the end of May. The closing date for the NAV Center now is June 3rd, Monday, June 3rd, and it had originally been scheduled to be May 31st, but it was pushed out to June 3rd to accommodate some folks that had June 1 move-in dates for their housing. And so Monday, June 3rd is the new exit date. Of the 46 people that are still there, 10 have move-in dates that are scheduled for on June 1st, probably, most of those cases, all of them for prior to June 3rd. 28 are actively working on their housing. They've got referrals. They're waiting for their their units to be ready, and they've all accepted alternate shelter where they'll stay during that interim period. And that period will be anywhere from a few days to several weeks while they're waiting for their unit. And then 8 will likely be exited prior to June 3rd because they're not participating and engaging in services at all. And so the staff are working hard to find, to persuade those folks to accept some alternate shelter, which is not as easy to do as you might think it would be, and then to help them get there and help them land somewhere safely, but they're going to have to exit the Navigation Center because it's closing. One thing I wanted to say about the housing. So 52% right now of the 130 that have left have exited mostly to housing. 57 of the 130 have exited to housing. That's a really high number. So that's a very high exit rate for an emergency shelter in a very short period of time. And so there's a few reasons for that. One, I think the primary reason is because Avivo, Red Lake have a partnership where they are leveraging housing supports funds from the state, and they're able to get people into private market housing very quickly with that resource. The resource is really great. It's very nimble. It's an uncapped resource. One of the challenges with it is that it doesn't pay until the person's in their housing. And so agencies have a very hard time. They don't have any funding to underwrite their work with people while they're still homeless. So while all the work that it takes to get people their IDs and get their self-situated to be able to move into a unit is totally unresourced with housing support dollars. And so what we were able to do was pull some philanthropy funds and some funds from DHS at the state together to enable Avivo to scale up their team by 6 additional case managers. So what that really amounted to is we pulled together $243,000, which paid for 6 case managers for 6 months. And those 6 months then could be spent with folks at the Navigation Center to help them get into housing. And so that's a lot of why we have really good housing outcomes there. Otherwise, we were relying on coordinated entry, as has been referenced here already today, and other resources that are available but much slimmer and much slower to turn. So the housing support was really a major factor. I think another factor in the good outcomes was some of the benefits I mentioned at the beginning. The co-location of services and shelter in one place makes it a lot easier for folks to connect with each other and get help and move and make progress. I would say that the Navigation Center's been open for less than 6 months, and so the long-term the housing longevity, I guess I would say, for those folks that were placed in housing during their stay at the Navigation Center, it's a little too early to assess that. They haven't been there long enough in their housing.
Could I just interrupt?
Yep.
As you keep talking about how great the 52% is, and I have to admit that I'm sure there were some of us who were hoping it would be higher.
Yep.
We were hoping with enough support and enough wraparound services that we could get more people housed. What tells you 52% is a good rate? Are you looking at the rate of overnight shelters or other placements from other cities, or what can we compare it to?
No, that's a good question. So I think what I understand from the local data on shelter placements from shelter into housing is that the best rate is around 15%. The highest performing shelter locally is hitting about a 15% placement into housing rate. And that is also, in my experience, pretty high, and because those are shelters that are mostly open only at night, And it's very hard to do. You can't really do case management at night because none of the service agencies are open. And so 15% for a nighttime shelter is very high. And so 52% is extremely high. And I think it's a lot of the reason it was able to be so high is because of this housing support resource that we were able to leverage, because that's housing that's available in the private market. Now, there is an issue where at some point the private market is going to be saturated for these low-cost units. We might be getting there already across the city, but that I think is really why a much higher than average housing placement rate was achieved at the Navigation Center. And 52%, you're right, it doesn't seem that high, but it is in our experience locally and nationally also. It's quite high.
And it's wonderful for all those people who were helped, but for the other, I don't know what number is, 70 or so who weren't and didn't have a positive outcome. I suppose.
Yep, yeah, it's
it
true.
Wasn't so good.
Yep, I understand what you're saying. So I think this is the last slide. So the closing date is June 3rd, as I mentioned. There's right now projected to be about between 20 and 30 people that are still there at the end of, on that date, all of whom have housing that just isn't quite available for them yet. And so they'll be staying at other shelters. One of the things that's happening for that group during that time is that different community agencies, St. Stephen's is quite involved, and other outreach agencies, and also Avivo and other programs are staying connected with those folks to ensure that they don't get lost kind of to the winds after the place closes, and that they do make it to their housing placement. Additionally, the last point I guess I'd make is that when Avivo was able to scale up, they have a model where for every case manager that they hire, they can house 15 people. That's their operational model. And so when they added six new case managers, that equals 90 more people. And so they're continuing to be available to all the folks that didn't make it so far into housing from the Navigation Center. Avivo is still available to them. We're trying to connect them with outreach workers to make the connection. And so they don't lose that opportunity. And then other people too. I will say that there's, this is certainly a service-rich project in Minneapolis, but there are hundreds of people living unsheltered in our city. And so this is a small number of the overall number. So that's the presentation. That was a very quick update.
Thank you very much.
Yeah.
Questions or comments? Councilmember Bender.
Thank you, Mr. Chair. And I just want to note that our city coordinator, Ms. Rivera Vandermeid, had hoped to be here, but she had to step out for a meeting with the mayor. So I just wanted to ask a couple of questions that really may be more like statements now that she's not here. But Ms. King, I wanted to note just that the Pollad Foundation was able to provide the funding for Ms. King's position, and we were very grateful for that. And can you remind me when you started or when that donation happened?
I started, that's a good question. I think it was the middle of October.
Okay.
I think that's right.
That's about my recollection too.
Late September. I mean, I started helping out a little bit before that was in place, but I think that was in place, at the beginning of October.
Okay. Because, one of the things I just kind of wanted to note as we reflect on this experience and look forward is that the City Council approved $1.5 million on October 16th for this particular use without having any internal staff whose job it is to design or shelter people experiencing homelessness. And I was concerned at the time and remain concerned that when we make a large capital investment like that we are staffing our interventions appropriately. And I know that we had enormous numbers of staff, our department heads across the enterprise, and folks who, sort of stopped doing their regular work in order to help with this situation, which in my opinion caused other problems and significant delay on other work products, and in itself was not ideal. And then I also was struck by how little engagement was done with the shelter operators, considering that the city was stepping into a role that we do not usually play in funding a large capital investment in a shelter. And so actually felt like I had to personally intervene to make sure that operators of shelter were involved in designing the facility in a very late in the process. And so as we move forward, I think if we're considering stepping into a role that the city doesn't normally play, would be to our benefit collectively to understand, have we staffed it appropriately? Do we have the supports in place? I recognize city funding was not used to provide the Avivo navigators that ultimately helped house people. And if we had not had such a collective response from our foundation community, that we would probably have significantly worse numbers. And again, just want to reiterate my appreciation for both our shelter operator community and our foundation community who stepped in to make sure that this was ended the way it did, as well as it did. But in the future, I hope that we can engage those partners from the beginning, make sure that we're really engaging more proactively with the county, which is, of course, in the normal course of business, the funder and operator of shelter. And so these are just comments. I don't want to put you on the spot, but I did want to say these things as we understand that homelessness is rising across our state, that has a particular impact in our city, and knowing that this problem is likely to persist, and we have thousands of people across the state who are experiencing homelessness. We have hundreds of people on the street every day. And so when we think about using city resources to help folks either get into shelter or get out of shelter into housing, that we do it in a way that is staffed appropriately, is engaging the right partners, and seems sustainable over time.
Yeah, I would just say I agree with all of that. I mean, I think, when I have reflected on this a lot, because I think that, the city and the county and the state and all the community partners, for sure, came together to respond to a crisis, and they came together, everybody came together quickly and stood up something that really saved lives over the winter. I do believe that. And I think going forward, we should take time to be more planful. For all those reasons, yeah.
Well, thank you very much. I don't see any other questions or comments. Steve, did you want to say anything?
No.
Okay.
Margaret, thank you.
All right. Well, thank you very much for all that you've brought and did for this, too. I think that we really owe gratitude to lots of people who aren't here as well, but we couldn't have had the amount of success that we had without an amazing group of people working on this. Did you want to add something, Councilman?
Thank you, Mr. Chair. Just since I was a little negative there, I do also want to highlight that on the plus side of this experience, I think this investment showed that folks who maybe sometimes are considered impossible to house or who are really not being served in our system really can be successful if we put the right resources in place. And I don't want to lose sight of that, or the understanding that going forward, we will continue to have populations in our city that need this level of resource and support. And so I think part of our jobs as local elected officials, as I'm part of statewide conversations, is to build the support in our communities to site low barrier 24-hour shelters, to think about how we reduce the stigma of IV drug use and support of folks who are using drugs to get into shelter and into housing. And all of those things are part of the work that we do. And I think that this experience highlighted in a hopeful way that when we put the right resources together with partners, that we really are able to get a lot of people into housing.
Thank you for putting a little bit of a positive note on that idea. I do think there's some things that we did here that we could replicate, or could inform other shelters, or could open a doorway for, here's other ways to do things. We did hear from a lot of people about how the barriers kept them away from shelters, and there were a lot of reasons why they didn't go. And then we heard a lot about how there aren't wraparound services and supportive services to help people find housing at the other shelters. So I'm sure that this conversation will keep going in other areas, and I think Councilmember Ellison has some words of wisdom.
I don't know about words of wisdom, but I just wanted to say that the city sort of jumped into this endeavor with a lot of political will, but virtually no know-how. And so, as the council president illustrated, and I think that we really I just wanted to put a finer point on the thanks that we owe to Simpson and Red Lake and to Margaret, your help in stepping in here as well. And I think that while I'm impressed and totally, floored by the amount of success that there was, I definitely take to heart the idea that we do need to be mindful, because I think that this wasn't we sort of gave it our best shot, but I do think that there are better solutions that if the city's going to take this on, that we can engage, so that we are making sure that we're housing people in a way that is dignified, that we are not sort of flying by the seat of our pants and relying on really, really competent outside help to sort of step in and save the day. So just wanted to offer that extreme thank you to those three parties, yourself, Steve, and Red Lake as well. So.
Brief, and I'll be writing some kind of a report with recommendations, and it'll be much more detailed. But one of the partners that I don't want to forget, since we're thanking people, is the MUD organizations. It was really critical, their help, and so I think what you said, Council President, is totally right, that with the right supports, anybody can succeed in housing. We know that, and we don't, not just anecdotally, but we know that from a lot of research. And I think one thing that we learned here is that if there's the right kind of housing with the right kind of supports for people, and we could even skip over shelter altogether. Just move people into housing from the street. That's what happens if you have the right resources. So I think there's a lot of learning that we've done here, and it'll be really exciting to see what happens next.
We'll look forward to that report with recommendations. And you're inspired.
Yeah, I was. Just one quick comment. Thank you for all the positive remarks about this. And really the negative really falls largely in the area of the inefficiencies that came from the way in which we had to ramp this up, right? So learning from that, then, the best thing that we can be doing to solve for that is being forward-looking in terms of how we move forward. We've talked a lot about how low barrier, service-rich shelter environments work. That allows us to get people engaged with healthcare and with housing and harm reduction and all the other critical services. The way to deal with the inefficiency is to be doing that work now, as opposed to December 11th. When winter is upon us and we're scrambling to try and find something more humane for a portion of our neighbors. And one last quick shout out for organizations that are critical partners, especially these past couple of weeks where we've been dealing with some safety issues around the navigation center. Is Minneapolis police have just been tremendous, from all the way from the beginnings at the encampment through and being right alongside us, learning with us as we operate in a lot of tensions in this environment, and they've been present and very human and learning with us, which has been great.
Thank you very much. I appreciate that. And I also want to just give a thanks to our own staff. The city coordinator's been named, but there's also CPAD, and I think we should emphasize Chuck Lutz and his involvement in this and kind of getting tasked with this and assigned with it to kind of move it along and gather their forces together. So I appreciate that. And on that note, then, seeing no other comments, I will move to receive and file this report. All those in favor say aye. Aye. Any opposed? Seeing that, that's approved, and then we will adjourn the meeting. Thank you very much, everybody.